everyone. Mark Hackle, Macomb County Executive. Deputy John Paul Rea, just kind of giving you an update what's going on with the COVID issue here in Macomb County. And interesting enough, these are some of the graphics we have on macombgov.org when it comes to the COVID-related concerns or issues. And it's interesting because we do from time to time get emails and people questioning some of the data statistics, and even more recently, some of those that want to make sure they challenge me on some of the information we have out there. I want to make sure people truly understand what the statistics and the data means. And we keep talking about flattening the curve, and we have done that here in Macomb County. So you've got to look at the numbers in totality as opposed to looking at one segment of it, I guess, if you will. So let's take a look at this. If you take a look at where we were at back in March, that was the onset, March 13th, first case we ever had here. And again, we were inundated when you stop and think about the number of tests we had, and then obviously the total positives. It was pretty compelling. We were headed in the wrong direction, and we needed to figure out what to do. So we put in place the emergency orders. We had 7 days to try to figure it out, and we got support of the Board of Commissioners after that 7 day, because when you do have some state of emergency in play, you're taking away powers of the legislative branch. So they willingly allowed us to get another month into this to figure out what we needed to do. Month of April, we had 20,000 cases, still trying to figure out what we're doing with our testing. That was still a big challenge for us, and yet the number of positive tests was really incredible. Back then, remember, people were kind of discouraged from taking the test unless they had some type of symptoms. And so they weren't really allowed in. So we were about 30% at that point in time, and 600 deaths as a result. So what happened? Well, we finally started getting a handle on what we were doing with the testing. And as you could see, as it migrated to August, 66,000 people were tested here in Macomb County alone. But with that, we only had 4,600 test positives. So if you compare, it's about the testing that made the difference. So what's important about this isn't so much the number of test positives, it's the percentage of people that tested positive based upon the testing that you're doing. And so with that, this is the significant issue when we talk about flattening the curve. Flattening the curve has a lot to do with the percent of positives out of the number of people you're testing. And along with that, it's the number of deaths or the impact it's having on the healthcare system. And the healthcare system here in Macomb County has been pretty clear. They got about an 8% capacity right now in their facilities of people that have COVID, whereas once upon a time, early on, they were concerned about 100% or beyond. They were looking at having a concern as far as the capacity at that point in time.
Mark, you illustrate the fact that there's a tremendous amount of data that we're tracking on a day-in, basis, not only here in the county, but with our statewide partners and our partners among the region. Clearly, this data indicates that we, again, are containing multiple elements affiliated and associated with this virus. The other thing that we've always said clear and open is the numbers as far as the gross of individuals that test positive for this are going to continue to aggregate, and they're going to continue to rise every single day. I think this illustrates the fact that when we look at our entire systematic response, we've had a positive impact with it, and we'll continue to refine that day in, day out with the resources that come in and the providers and partners that we have throughout the county.
I think the confusion is they'll go to some of those that are questioning that we really flatten the curve are using this particular graphic that we have here. And basically it's this one here where we're showing kind of the inverted bell curve. This only has to do with the number of tests positive. So early on, when we were testing very few people, we had an incredible amount of people that were testing positive. Here, when we're testing 60,000, nearly 70,000 people, these are the test positives. So this was just a graphic of raw numbers of people that are testing positive, but some are looking at this saying, oh, you haven't flattened the curve. Well, let me suffice it to say, all across the state, we have flattened the curve. And if we didn't flatten the curve, or the curve wasn't flattened, I don't think you would have seen the governor lift the stay-at-home orders. I don't think you'd see the, I guess if you will, reinstituting some of these businesses that are coming back in line and being able to, open up and allow people in. We know there's still a concern, no question about it. But the curve has been flattened. This is not the curve. This is one aspect of the curve, if you will. And I know enough about this to get myself in trouble, so let's go back to. This is the graphic we want people to truly understand and get a better understanding or meaning of. This here is really the graphic depiction of the concern we're seeing here in Macomb County, and it's very similar to what you're seeing everywhere else around the state. And I need to point this out too. If you look in this line here, when we start looking at what happened, I mentioned earlier, this is when we decided that we had to do something with the state of emergency here in Macomb County, and we took the role, I guess if you will, away from the Board of Commissioners, the legislative branch, and said we need to get some things established, basically PPEs. What are we doing about testing and all the other critical things? How do we get people out of the county buildings and try to figure out how do we displace them so they're working off-site someplace? And we were able to do that because the Board of Commissioners, the legislative branch, allowed us to do that. So what happened? Once we got those things in place and we realized we can now, I guess if you will, repair or put back some normalcy to the constitutional provisions and working with the legislative branch, we did that. And in doing so, we've been able to see these numbers drop because we're working in concert with our legislative body. So again, we have flattened the curve. We're going to continue it. My big question and concern, and some people get upset about it when I ask the question, in particular to the governor, is how do these numbers relate to opening certain businesses? If we're going to open something, how is that related to a business wanting to open? So I offer this up. What will it take for movie theaters now to open up across the state? There is no definitive answer to that question, and that's the question to keep asking. And when I do, people say you're in conflict with the governor. You just let the governor do her job. The governor can do her job. I'll continue to allow her to do her job, but I'm going to continue to ask questions because I got business owners asking me those very questions, and I don't have the answer to that. So, did we need to have the state orders in place at the onset? Absolutely. Did we need to figure out how do we shut down businesses that were non-essential? Without question. Did we have to have state of emergency declarations? We did. We here in Macomb County did. But as we continue to flatten this curve, there's still going to be the continuous questioning of what we're doing so that we have answers as opposed to waiting for some kind of a press conference to give us direction as to where we're going. So yes, I will continue to ask those questions. And for those that want to continue to claim that there is no flattening of the curve, I'd have to disagree with you based upon the numbers in totality rather than raw numbers of one particular area talking about test positives. And our health department has been intimately involved and done a great job going from six people doing contact tracing back then to now having 60 people that do the contact tracing throughout the county as well. So good things happening, actually.
Mark, I think systematically we've responded on a number of fronts. We've allocated resources that not only came in through the Federal CARES Act funding, we've taken responsibilities for staff members and put them directly affiliated with COVID. I think it's the illustration of just how volatile these numbers are on a day in, day out basis. But again, as we've talked about the whole notion of containing and having that systematic response, I think we're there. There's going to be blips, there's going to be hiccups along the way. But whether it's with kids going back to school today, whether it's new businesses opening up, we have information, resources, and are directly involved with those individuals that are phasing back in their businesses or those school administrators as they're bringing children back into the learning environment today. I think the other positive thing that we look at over the past 4 weeks here, that percent positivity rate, which individuals were saying was in the mid-7s, we're in the mid-5s now. Those are good trends, hoping to sustain them. A lot more engagement and information is going to our emergency management liaisons at the municipal level, and we're working day in, day out with our municipal partners across the county to get them strategic information in areas like Sterling Heights, Macomb Township, and Utica. We're tracking this virus, we're understanding the spread around the community, and we're going to use those resources to respond as expeditiously as possible.
And as you mentioned, the resources that we got for the CARES funding, I mean, it's $150.2 million that we got from the feds on this, and we're distributing it, but we're doing it in a very calculated way. I know there's some folks that have already kind of blown through their cash that they've got, from the feds. Here in Macomb County, we've still got about a good 3-4 months to go, and we're making sure. But again, there hasn't been a need that hasn't been at least met or satisfied by the connections with Macomb Community Action, our planning department when it comes to dealing with the businesses, our schools that we're looking for support and help, whether it's a technology side or PPE side. Here in Macomb County, our planning department, our emergency management department, our finance department are all working together to continue to figure out how do we spend that money appropriately. And we even brought in the auditors to make sure it is, I guess it falls within the guidelines of the federal requirements of getting those funds, how you distribute them. So it's all being audited, and we're making sure that we're crossing all the T's and dotting the I's, I guess, if you will.
Mark, an unimaginable sum of money that was just dropped up on us on the first week of April. It's a sum of money that we've not only been able to integrate into the day-to-day financial operations and ensure that our auditors followed strict compliance with the federal guidelines, but I think the other thing is here, as we head into the fall, we are prepared wherever this virus goes, not only with regards to the community spread, as we bring schools back into the mix here, and as we continue to support businesses around the county. Also, systematically with strategic support that we're putting in additional resources into the medical examiner's office, also additional resources into our food supply chain. Those are critical resources that are going to spend that down in an appropriate way, and as you said, ensuring that we're following all the programmatic guidelines.
Yeah, and on that line we talk about the schools and how involved we've been with our school districts here in Macomb County. And I say that because if you stop and think about it, every legislative body is engaged with executive branches throughout the state, whether it's a county, a municipality, and even at the localist of levels, if you will, school boards, they were tasked with giving that most difficult decision as to what are we going to do with our school children district by district. I mean, so the school boards, the legislative branch, worked alongside the superintendents and administration to make a determination, what are we doing with our most precious commodity, our most precious resource, and that's our children, and try to figure out how are they going to get back to school and what is that going to look like. And so not a lot of direction at the state level to try to figure out how do we deal with this when it comes to the PPE. What are we going to do about if somebody does test positive? How do we respond to that? Even the lag that we're seeing when it comes to the statistics and the data coming from the state, our health department is working directly with each one of those school superintendents, and we've been engaged for the last 2-3 months so that we knew once this day came, whether they're in school, out of school, we had a plan systematically of how we're going to deal with each one of them individually. And I got to tell you, not only the financial support, PPEs, the support that we gave for computers for those that are doing, the off-site learning, but directly in those schools, if there's an issue or concern, we're going to be working alongside them to make sure that we're adequately trying to figure out how do we support that and get the word out.
Strict protocol in place, not only with regards to notifications within a specific school building, information on a day-in, day-out basis that goes directly to school administrators and affiliated healthcare professionals within the county. Mark, this is a system that undoubtedly will be challenged when we have those 130,000 kids in our K-12 system, whether they're in a digital environment and they need some technology support, or whether they're going into the classroom today. We want to continue to be a part of that feedback loop. We want to ensure that they're in the most safest environment that they can be, and parents and advocates and guardians are getting that information at macombgov.org.
Yeah, so again, we know the curve has been flattened. With that being said, it doesn't mean we let our guard down. We're still continuing to try to figure out how do we make sure people are wearing the masks. We here as a county have not brought people back into the county businesses in masks because we know there's still a concern out there. There still is that spread. But again, much different than what it was at the onset. And so with that being said, I will continue to be an advocate on behalf of business to try to figure out, what are we doing and how are we doing it by asking a lot of questions, because that's what people hired me to do rather than just accept something at face value. But with that being said, here in Macomb County, we got the support of our Board of Commissioners. I can't be more thankful for that, because even they know or realize there's still a concern out there, but they trust the people that we've got, yet we're giving them the proper information so that if they are going to be supportive of it, they know what they're being supportive of. So we got a good thing going with our board here.
Yeah, Mark, the other thing is with regards to the data and the information. Look, there are over 880,000 residents in this county. There's 18,000 businesses, and whatever individual decides to go to macombgov.org, they can click on this information, look at it, splice it out, figure out whatever it is, whether it's to meet own personal sentiment or to be a part of an argument. Again, as we've always said, undoubtedly there will always be extremes when we look at this, but we're going to look at this for the strategic level-headedness to ensure how do we continue to respond and how do we tell a story of what's really happening in our community.
Yeah. So with that, kind of on a more upbeat, lighthearted note, if you recall, there was an event that happened over the weekend. It was called the Kentucky Derby, one of my favorite events. I was not able to go, but I think there was a prediction that was. There was. You know what?
Last week.
Hang on a second. Let's play that tape back for a moment here. There's one thing that I actually enjoy doing, and along with my wife, we go down to the Kentucky Derby. This year, unfortunately, because of this COVID, they're not allowed to have fans. So I'm going to be watching it on TV, and not having a house party as a result. But I will be watching the Derby races, and you can pretty much bet my $5 bet is going to be on Authentic. I'm a big gambler. You were just saying something about me now giving advice.
Yeah.
Who picked the winner?
I think you did. Yes.
I did.
I think that is on record. There is video confirmation.
Man. Authentic. I knew it. It's like, but again, what worried me was that I knew that about 2 months ahead of time. I shouldn't say I know it. I was one of those. It was as I looked at different aspects, I figured this could be the horse that could pull this off. And interesting enough, when I saw, was it Tis the Law, Authentic? Who's the other rising star that was up there? There were the three front runners. Drew the worst posts. I mean, they got the 18, 17, and 16 posts, and yeah, that made me a little bit nervous when I saw saw that. But yeah, there was quite a yahoo coming out of
That's good.
out of me when I saw the,
Excellent call,
the
Mark.
race itself on TV. Unfortunately, couldn't be there in person. So with that being said, again, hopefully you took that advice if you listened to it and bet on authentic. If you didn't, well, next year I'll give you, I guess, if you will, another tip, and we'll see how that goes. So in the meantime, again, we want to thank you for tuning in. We're going to continue to stay up front and on this issue as we move forward. But again, we want to thank you for tuning in, but more importantly, we want to remind you to keep you and your family safe.